continued breastfeeding in order to fill any nutrition gaps. So it's very important, infants and toddlers being given good nutrition. Yeah, before proceeding, I would like to ask you, can you tell me what is the period of infancy when you talk about infancy? Yeah. Which period is called infancy stage? Which period? From which month to which month? Which period is called infancy stage? Can you tell me that? Any volunteer? Infancy period. Hello? Can you please respond to my question? Infants period covers which month? From which month up to which month? Hello, can you hear me?
Yes, madam. Can you?
So you don't want to talk? Don't get me angry. I'm going to stop the Zoom just now.
I can try.
Infancy stage
Yes.
is when we call the child is under 12 years of month.
Yeah, from the period from birth to 12 months or 1 year. What about toddler stage? Covers which period?
From the time of birth to 3 years.
No, we've said infancy stage is from birth to 1 year or 12 months. So toddler stage starts from 1 year at least to 3 years.
To 3 years, yes.
School age, what about school age? Normally from 3 or 4 months, 3 or 4 years up to 12 years. That's we call school age. Okay. Let's look at nutrition requirement during infancy and toddler. We've said that nutrients needs for infants and toddlers reflect their rate of growth. So because they are doing a lot of activity, especially during toddler stage, expended tend to increase and also differ between the infancy and toddler stage. Basal metabolic needs according to the activities and interaction, nutrients also differ between the two stages. Infancy is the period, of child life between from birth to 12 months, 1 year. Yeah, and toddler stage from 1 year to 3 years. Inadequate nutrition during both stages can lead into stunting growth. So if the infant and toddler are not well fed, they'll just end up into being stunted or having low body weight, that means underweight, and delayed cognitive and physical development, and even death. So ensuring that infants and toddler gets proper nutrition is very important for the child to reach potential cognitive, physical, and emotional development. Yeah, infancy is characterized by extremely rapid physical growth and development. During the first few days, most of the infant after being born, they tend to lose a little bit weight, in order to customize into the new environment outside the womb or outside the fetus. So, because they start customizing themselves into the new environment, they tend to lose weight. But then they gain weight again. Yeah, basically, they tend to, after 7 to 10 days, they regain the weight they lost. And normally, the birth weights tend to double, between 4 to 6 months after birth, and tend to triple within first year of life, that 12 months. At the same time, organs of the infant tend to start develop slowly, in order to do complex functions later as the infant or toddler grows. To ensure this growth and development proceed optimally, infants need to obtain adequate amount of nutrients. Yeah, in the recommended amount, need to be given high quality protein, need to get high quality fat in order to get essential fatty acid required for proper growth, and vitamins and minerals and other nutrients which are required in the recommended amount. Yeah, we've already talked about infant to lose, body weights, as soon as the infant has been delivered, they are about 60%, we've already talked about that. And the amount of weight gained by infant during the second year approximate the birth weight. Infants increase their length by 50% during the first year of life, and it doubles after 4 years. The total body fat increases rapidly during the first 9 months, after which the rate of fat gain tempers throughout the rest of the childhood. So it's remained there through the childhood stage. So it's very important to make sure that the infants and toddlers are not overweight or obese. Yeah, because that situation will proceed as they grow. The stomach capacity of infant also increases the range of 10 to 20 meals by first year, enabling infant to consume more food at the given time and less frequent intervals as they grow. As we know that infant, after being delivered, infant should be fed breast milk after, as long as every time the infant needs to breastfeed, he needed to be breastfed. And during the night, we know that infant tends to sleep 2 hours. After every 2 hours, the infant tends to wake up and want to be breastfeeded and then sleep a little bit. And then because the stomach capacity at that stage is very small. So as the infant grows, the stomach capacity also increase, and it can sleep for a little bit longer hours compared when the infant has been born. Fat absorption varies between one neonate and another. Human milk fat is well absorbed compared to other sources of milk like cows or other types of animals, but butterfat is poorly absorbed, and fecal excretion normally range between 20 to 48. The fat combination is commercially prepared in infant formula are well absorbed because they get the copy from the breast milk composition. So most of the formulated or prepared infant formula normally have good amount of nutrients required by the infant. And they differ, the type of infant formula which are fed to the infant in the first 3 months tend to differ in this after another 3 months. So 3 months have got a specific infant formula, and 6 months have got specific another infant, to make sure that child gets required amount of nutrients according to the need. Activities also of enzymes, in the digestion system of the infant. Also, there are maltase, which help to digest the saccharides, and isomaltase and sucrose normally stand to be produced in the first 28 to 32 weeks of the gestation. Lactase activity responsible for digesting, we know the saturated milk, which is lactose. Also, enzymes are produced when the infant is born. Pancreatic amylase, which digests starch, continues to remain low during the first 6 months after birth. Infant consumes starch before this time. That's why when infant consumes starch during this time, before reach 6 months, it's very difficult, to digest. So we are not allowed to introduce this solid food which contains starch before the infant has reached 6 months. Because the low amount of pancreatic amylase, which is responsible in digesting starch. So if the infant consumes starch before this time, increased activity of some salivary amylase and digestion in the colon usually compensate. But it's not, but we don't advise to do that. It's not advised to do that. The neonate has function but physiological immature kidneys, at the infancy stage, and kidney tend to increase in size as the infant grows. Concentrating capacity of the early weeks of life, they are not very functionable. The kidney size tend to double after 6 months and triple after first year of life. That's why we also advise to introduce solid food after 6 months, so that the infant can be able to proceed, because the kidney now are a little bit matured, can do some kidney functions. Now let's go to weaning process of infants. Before going to that, can you tell me what is weaning? What is weaning? Any volunteer? What is weaning? What is weaning? Normally the infant is weaned later in certain stage of life. What is weaning? Weaning, which is written W-E-A-N-I-N-G. What is weaning? Any volunteer? Okay,
It's a transition from breastfeeding to introducing the baby to other foods and solids while still breastfeeding.
Excellent. Weaning is the process of gradually means slowly introduction of solid and semi-solid food to the infant, by also continuing breastfeeding the infant. What is the time of weaning? What is appropriate time for weaning an infant?
As soon as he reaches 6 months.
Excellent. That is appropriate time of weaning the child. And what is the difference? Is there any difference between weaning the infant and providing complementary foods to infant? Is there any difference when you're talking about weaning foods and complementary foods? Is there any difference between the two terms? Another volunteer?
There is no difference, madam.
There is
no difference.
Can you please increase your voice, because I'm using I'm very loud so that you can hear.
There is no difference.
Excellent. There is no difference between introducing complementary food to the infant or introducing weaning food. They means the same. Weaning in infant is the gradual process of introducing foods and drinks other than breast milk or formula into baby's diet, where it's slowly reducing milk feeds. We reduce, but we continue giving the infant milk. It can be breast milk, of course, especially breast milk, because the child is only 6 months. We should proceed breastfeeding, or not, if not possible, provide infant another types of milk. Weaning, it's when a baby starts moving from only milk to solid or semi-solid food, plus milk, and then eventually to more solid foods. Recommending starting of weaning is 6 months of age. It's important for infant to receive iron-rich solid food at the start of introducing complementary feeding or weaning, because their natural iron supply is no longer enough to meet their needs. Iron stores that the infant has been using now has run low. So in order to prevent the infant to become anemic or having iron deficiency, it's very important to introduce iron-rich solid food. As we know that breast milk does not have enough amount of iron. Yeah. And the baby tend to use more of the iron which has been stored in the body while the baby is still in the, in the mother's womb. Yeah. And breast milk, we know it contains small amount of iron and cannot meet the baby's increasing needs, especially after 6 months. So example of iron-rich foods which need to produce during weaning is iron-fortified cereals, mashed meat, beef, chicken liver, because we know those are the good source of iron, mashed beans and lentils, also those are good source of iron, and mashed dark green vegetables or puree vegetables. Yeah, in a form which the child, the infant can be able to eat. Yeah, now let's look at the process of introducing weaning or solid foods or complementary foods. Normally, we start with the soft foods, mashed fruits like banana and avocado, those which are not very acidic, or porridge, or cereals, or puree vegetable, or mashed pool vegetable. Yeah, because we need some iron. Yeah, those are the food which we normally start with. Then gradually we increase variety and texture from smooth to lump or small pieces. After that, we reduce milk dependence over time. Then, though milk is very important, we reduce the amount of milk, but now increase the solid food. Now this is the third stage. Some types of foods which are more likely to cause allergy reaction, those foods include dairy products such as cow's milk, cheese, yogurt need to be introduced in small amounts. Also, some other types of foods which can cause allergic reaction like eggs. Yeah, some infants are allergic to eggs. Some are allergic to peanuts, tree nuts such as almonds, cashew nuts, walnuts. Also, some are allergic to fish and seafoods. Some are allergic to soya and wheat. So we need to make sure that those things which they might be allergic to infants should be introduced in small amount. Not before that. We need to avoid and reduce those types of food which may cause allergy when introducing weaning food. And weaning foods should be introduced one at a time in very small amount first. Yeah, so you introduce this type of weaning food and you feed the infant at least 2 to 3 days up to 4 days and try to look at any symptoms which might be shown if that infant is allergic to that specific type of food. And then if the infant is allergic, don't feed again that type of food. If it's not allergic to infant, then you proceed with feeding that types of the food to the infant. So you introduce in small amount, one type of food at a time. Try to observe if there is any allergic symptoms, stop. If not, proceed and introduce another type of food. At a time, observe it, then introduce another type of food. This is how it's done, so that you can see if the infant is allergic to that specific type of food. Why introducing complementary food before 6 months of age is not recommended? Why do you think it's not recommended to introduce or to wean the infant before 6 months of age? What do you think? Why is not advised to do that? Introduce early or early weaning. Why is not advised to early wean the infants. And tell me, what are the reasons? What can be the reason? Why is not advised to do early weaning? Anyone can speak. It's not necessary to get it right. Just try to give an answer rather than staying quiet.
It might be due to immature digestive system of a baby, also poor immunity system of a baby is not well. So sometimes when you introduce it early, can lead to some infection, and the baby is not well developing maturing immunity, or he can acquire infections.
Let's talk one point after another, because here you speak a lot of things together. Just give us one reason you think, and others will be given by other people. Other
Digestive system is not matured.
Yeah, it's not advised to introduce weaning food early because the digestive system of the infant is not well matured. That means it does not have certain enzymes for which are involved in the digestion nutrients. And if so, that it would not be possible to digest those nutrients, and so they're able to be absorbed. One of the reasons. Another reason, another person, another reason.
Another reason, in order to get complete milk, as the milk is not easy to get from the other food.
I don't get you. The question is, why advise food before the infant is born?
In order to get complete nutrient from mother milk, that is found in the mother milk easily.
Yeah, excellent. In another way, it means that
Recording in progress.
What is the relationship? Can someone explain?
Maybe I can help his point.
Yeah, you're welcome.
After the baby is born, there's this postpartum after.
I cannot hear you.
After the baby is born, the mother is going to do the postpartum.
The what?
The first stage of labor and planning stage, which depends on breastfeeding of the baby, so that the mother can heal easily. Uterus. Production during this. So during this.
I cannot get you. Okay, let's proceed. I cannot hear you properly, and I cannot
Can
get
I
the
help?
point. Okay, so there is. The reason, as we said, the digestive system is not immature, and also it increases the risk of infection, as we know that the utensils which have been used to cook, prepare the food, if they are contaminated, so the infant will be at greater risk of being infected, getting infection, which is not good, because the immunity is still very low. Also, we've already talked about reduces breast milk intake. Yeah, we've already talked about that. Also, there's high risk of allergies and sensitivity because the immune system is not well developed. Also, there's a risk of having iron deficiency anemia. Yeah, because normally the foods which are introduced earlier, they're usually low in iron. Yeah, so this will replace the small amount of iron which the infant receives from the breast milk. So this is not very good also. So those are the reasons. There are more. Also, poor nutrient balance. Baby is very specific. Yeah, babies are very specific balance of nutrients which they can get it in right amount from the breast milk. So by introducing those early weaning food, it might lead into poor nutrient balance. Also, there might be the development of redness in lacking. Some young infants cannot control their head, so it's very difficult to swallow food and giving them solid food. So it might choke them. So it's not very good. Okay, that is why is the advice not to introducing weaning foods earlier. But another question is, why is it necessary to introduce other foods apart from breast milk after 6 months now? Why is it very important? Why it is necessary to introduce weaning food after 6 months? Okay, quickly, please answer the question. Why is it necessary to introduce weaning foods after 6 months? Why is it necessary?
It might be due to demand of nutrient of a baby. As the baby grow, the demand of nutrient tend to increase. So only breast milk cannot be enough for a baby.
Yeah, excellent. Because the child is growing, so breast milk alone is no longer enough, supplying enough energy, nutrients for rapid growth. Yeah, because the needs has increased. Yeah, iron stores has been reduced to low and other nutrients. So we need those supplementary food in order to support rapid growth of the infant, because they'll provide all the nutrients, yeah, which are needed in the recommended amount so the infant can grow well. There are some other nutrients are needed for brain development, nutrients are needed for bones, for calcium, for teeth. Infant need to develop some eating skills, yeah, swallowing skills, develop coordination of hand to mouth. So it's very important. Also gradually transition to family diet. So those are the reasons, yeah, basically why weaning food needs to be introduced. Now let's look at the nutrient requirements for infants and toddlers. Yeah, energy, infant and toddlers require energy, and daily recommended intake normally is for infants is 520 to 570 calories, and for toddler is 676 to 743 calories needed. Yeah, between 6 and 12 months. So the first one between 6 months, early 6 months, the second one is after 12 months. The best advice is that you need to make sure that the baby gets enough energy. Yeah, look at the baby's hunger and satiety cues. Monitor baby growth, if the baby is gaining weight or not. So baby has to be fed the nutrient-rich food, whole foods. Make sure which foods which provide all the nutrients required for the proper growth, for provision of energy. Proteins also needed for growth, for the growth of the infant and toddlers. We know protein is very essential for infant tissue replacement and overall growth. So for daily recommended intake, for infant need 9 to 13 grams of protein per day, and toddler need roughly 13 to 16 grams per day. And this is depending on body weight. So protein requirement is calculated per kilogram body weight. Breast formulas provide good source of proteins. But after 6 months, some other source of protein should be food with other source of protein should be given to the infant. Carbohydrates also is primary source for providing energy, so should be given in the weaning foods in the required amount. So there's some other sources which are very good for provision of carbohydrate. The infant should be given in the weaning foods. Fats and fatty acid also are needed. Quality, good quality. Normally fatty supply energy to the liver, brain, and heart. The recommendation needed is 30 grams per fat per day. And also when we talk about fat, to look at good type of fat. Normally these are unsaturated fatty acids, which normally provide at least 4.5 grams omega-6 essential fatty acid, 1/2 gram intake of linoleic acid, and omega-3 fatty acids. So those are essential fatty acids which are needed for overall development. Vitamins and minerals are also required for infant and toddlers. And nutrients, as the infant grows, the requirement for vitamins and minerals also tend to increase. An infant between 0 to 6 months need about 400 international units of vitamin A. And when it comes to vitamin and minerals, the weaning food should provide the good quality vitamin and minerals. Here we're talking also about dietary diversity, give types of food, different types of food which ensure that the infant and toddler can get all the vitamins and minerals required by the body in the recommended amount. So dietary diversity. It's difficult to obtain daily intake of vitamin D from breast milk. It's not enough. So when introducing solid food, make sure also some other source which can provide vitamin D. And also it can also obtain from sunlight. Now let's look at the composition of human milk and breast milk. Human milk, which is breast milk and cow's milk. Let's try to compare. Normally, the composition of human milk is different from cow's milk or other types of milk, animal milk. For this reason, unmodified cow's milk is not recommended for infant, at least when the infant reach 1 year, at least 1 year of age or 12 months, you can give cow's milk. Although we tend to introduce this a little bit earlier than recommended, but you make sure that you need to, at least to know to dilute that cow's milk and know the proportion of dilution according to the stage or month of that infant. Human milk or breast milk provide complete nutrition. Human milk has got 60% whey protein, which are easily digested, and only 40% casein protein, which are difficult to be digested. While cow's milk has got only 20% whey proteins, which are easily digested, and a lot of tough casein, protein, which is 80%. Casein, these are tough, hard to digest card, and normally they are not good for infant stomach. They are not easily digested. So we prefer breast milk, which has got large amount of whey proteins rather than casein, which are hard to digest. Now here we can just first look at the composition of these two. When you look at the component of water, all breast milk and cow's milk have got 80% water. Energy, breast milk, provide moderate amount of energy, which is ideal for infant, rather than cow's milk have got slightly higher amount of energy, which is not balanced. Protein, breast milk have got low amount of protein, 1 to 1.5%, and which are easy to digest, while cow's milk have got high amount of protein, 3 to 4%, which are hardly for kidney to digest. Protein type, breast milk contain more whey. We say that more whey protein, which are easy to digest, and little amount of casein, which are high to digest. While cow's milk contain low amount of whey, protein, which are easily in high amount of casein, which are harder to digest. Fats, breast milk contain rich essential fatty acids, which are very essential for brain development, while cow's milk contain less amount of fat composition. Carbohydrates, breast milk contains high
Recording in progress.
diseases will be very low or will decrease when they grow to adult stage. So on the other hand, poor eating habits and physical inactivity when they are young at school age will be the problem when they reach adulthood. Energy, school age children require energy and caloric needs depending on the child rate of growth, child amount of physical activity, and also child metabolism. So amount of energy recommended depend on these three things. So it's very important, to make sure that children consume enough of calories depending on these three things. However, many children, especially those who are not physically active, they tend to develop too many calories. And this nowadays, that's why there are a lot of children become overweight or obese, which is not very good. Children between 4 to 6 years, they need 1,800 calories, and children between 7 to 10 years need to consume 2,000 calories. About protein, also school age children need to consume recommended amount of protein, and normally this is also determined by kilogram body weight, and where the amount of protein required tend to reduce as the child grows. During the infancy and toddler stage, they need more protein compared to school age children. During school age children, protein needed only 0.9 to 1.0 gram per kilogram body weight per day for school-age children between 4 to 12 years. Fiber is another nutrient which is very important for school-age children. We need to make sure fiber is their diet which they consume on daily basis. Yeah, for the proper bowel movement, yeah, digestion of the food. Yeah, school-age children need about 5 grams of fiber per day. Fat also needed by school-age children. Yeah, they need also to consume healthy fats, mostly from unsaturated fat acid in order to get all essential fat acid needed. By the age of 5, children should follow adult recommendation. Total fatty intake should not exceed 30% of calories. And also saturated fat should not provide more than 10% of total calories. So try to restrict saturated fatty acid, which are not very good for health. Instead, compensate for unsaturated fatty acids. Eat more. Yeah, and also cholesterol intake should not exceed 300 milligrams per day. About calcium, school-age children also need considerable amount of calcium. Yeah, they need to take the year between 4 to 8 years need approximately 500 milligrams of calcium per day. And for children between 9 to 13 years, they need about 1,300 milligrams per day. Other minerals, other nutrients, minerals are also required. Minerals such as phosphorus, magnesium, iron, zinc, iron, selenium, copper, manganese, chromium. They tend to increase in amount as the child. So you need to look at this dietary intake for the children. What are the recommended dietary intake of different types of mineral for school-age children? This is your assignment. Okay, vitamins, B and C is also needed by school-age children, and they tend to increase as the age increases. Vitamin A for school-age children needed between 4 to 8 years is 400 international units, while school-age children between 9 to 13 require 600 international units. Okay, I think that's all for the discussion. I would do the following questions, which will help you in the preparation of the coming, annual exams in June. Can you please not copy, I will just upload these slides in the Moodle. Okay, in the Moodle, I will upload today's slides in the Moodle. Of the 211 in knowledge area 4 area. Okay? Hello, have you understand what I'm talking
Yes,
about?
madam, we
understand.
I will upload this slide so that you can be able to get these review questions, because the time will not be enough for you to copy. Please, nowadays we have improved all our ODEX types of questions. So we teach you, and you need to apply what has been told to you. Knowledge which you get from the lectures, you need to apply the knowledge. So the question will not be very direct. What is winning? That will not be type of the question. Reasoning, thinking type of question, application of the knowledge which you have obtained. So the question will be a little bit different. That's why I'm trying to give you some sample of types of questions you need to apply for knowledge gain. So I'll try to, with you, with the question 1, at least give you insight of how to answer this type of question, because we don't have much time remaining. So I'm going to deal with question number 1. Question number 1 asks, discuss the nutritional requirements that should be met during weaning. Discuss the nutritional requirements that should be met during weaning. This is a discuss question. A normal it worth 50 marks. It might be, yeah, you might find this type of question in main term test, and when you find there, it will weigh 50 marks. Or if you find this type of question during annual, yeah, this will weigh 25 marks. So it needs to be expressed in very, very, very nice way. So you should start like this. In question like this, you should start by trying to explaining what is weaning. Because the question asks you to describe during weaning. So you should try to explain what weaning. What is the meaning of weaning? So you explain what is the meaning of weaning, which we've already explained during our discussion today. Yeah. After explaining what is the meaning of weaning, now you go on to discuss the nutrition requirement. Yeah. Why is it very important? What are the nutrition requirements which need to be met during weaning? So you look at the nutrition needs one by one, looking at different nutrients requirements. So you can start we can start looking at adequate energy requirement in terms of calories. So here you talk about infant need energy, the energy requirements of infant for growth, rapid growth and activity, as we've said. Yeah, here you talk about complementary food or weaning foods. Yeah, which source, which types should be those which provide energy, what type of food sources. Yeah, so you need to explain also the texture, yeah, in form which the child might be given, if it's in terms of thick porridge or mashed staples, because the infant does not have teeth. You need to talk about try to avoid watery types of food. As we know, watery food have got less and provide less energy. So you need to talk everything which are related to adequate energy provision or calories to the weaning food and their sources. Then you go to another type of nutrient needs or requirement. Let's say iron. Yeah, because the iron we know is very crucial. We say that breast milk does not have enough amount of iron. Yeah, and here we're talking about weaning period now. So the infant has already grown. So breast milk cannot at all provide enough amount of iron. And also we talk about the iron which has been stored in the body of infants during pregnancy has already been used in the first 6 months. So during weaning food need to provide the weaning food which have got high amount of iron. I've already give you different types of sources of foods which can provide high amount of iron. Make sure they're provided, yeah, to the weaning, to the child during weaning in order to prevent iron deficiency anemia. And also the iron is very essential for brain development and oxygen transport. Infant should be provided iron-rich foods. You mentioned the examples which I gave you. Then you go to another source of nutrients. Yeah, protein. As we know that during weaning, the child has already grown in size and the amount of protein need to be increased. So weaning food should contain enough amount of proteins from different sources, especially high quality proteins. Yeah, animal protein, and you mentioned sources, high quality proteins such as meat, poultry, that is chicken, feed, yeah, fish and fish products, dairy products, eggs, beans. You give different types of source, which can help to provide enough amount of protein to be able to support growth, tissue repair, and muscle development for infant during weaning period. After that, you need also to talk another nutrient, which is fat. Yeah, need to provide winning food which provide healthy fats. I've already talked about that. Unsaturated fats from animal base, yeah, to be in high amount compared to saturated fats from animal base, which are not very good for health in small amount. Then you give the sources of fat, good fats from plant base and also from animal base. Yeah. Then you go to another nutrients, which is vitamins, especially we look at vitamin A, C, and D, which are crucial during weaning period. Yeah, we know vitamin A is very essential for vision and immunity, yeah, for the infant. So even a few sources. Then you talk about vitamin C should be provide food source, winning foods which have got several amount of provide vitamin C. Yeah, and vitamin C help in the absorption of iron. And you give the sources. You talk about vitamin D, importance of vitamin D for bone and bone development, and also give source of foods which can be provided. Yeah, good source of vitamin D. Also, you talk about nutrients, minerals, and here you also talk, what is the function of minerals? Different importance. One, minerals is calcium and zinc. What is the function of calcium for the infant's growth? And also you mentioned source of the foods which can provide calcium. Also talk also about zinc, importance of zinc for growth and immunity function. And also you talk about source of foods which can provide zinc. So you try also talk about discussion can include a lot of things, not only which have been mentioned. You have to talk about importance of dietary diversity, introducing different types of food during weaning. Yeah, you can talk also about feeding frequency, and texture of the food. All those associated with weaning. Yeah, nutrition requirements during weaning. You can also talk about some food safety and hygiene. Yeah, because it's very important to make sure everything is safe and hygiene in order to prevent infection and contamination. You can also talk about provision of safe fluids, water, in recommended amount. And also avoid things like sugary drinks in order to prevent things like overweight and obesity. So you can talk a lot of things in the discussion which are related to nutrition requirements during weaning. Yeah, and when you discuss those which you tend to discuss both sides of the coin. Disadvantage and advantages. Of introducing these different types of food. So this is how the discussion is going. Have you understood what I've been talking of how to answer of this type of question? Question 1. Have you understood something there?
Yes, madam.
So I think that is enough for today. So I'm stopping here. So as I've said, I will upload this. I'll make sure I upload this immediately so that you can get those revision questions and try to discuss between yourself. Try to find different sources where you can get answers. Nowadays, there are a lot of ChatGPT and other sources. There's a lot of sources which you can get answers. So try to go and find the answers and try to discuss how to answer questions.
Sorry, madam. I have been so late, but I'm very sorry. Can I have some short revision on slide number 1 and number 5?
Now? You are joking. You want me to start teaching now? That's not possible, my love.
No, madam, not teaching, just a short, brief explanation on this topic.
The time is up, my dear. Next time, please try to come on time. What I can help you is that I say that I will upload today's slide so that at least you can be able to follow it on your own. Okay.
Okay,
Yeah,
madam.
please.
If I would
For
have
today, it's
run.
not possible. Yeah, I will upload these slides so that at
Okay.
least you can be able to follow. And
Okay.
also the
Madam.
revision question. But next time, please try to be, it's very important to be on these Zoom meetings.
I've been so late, like 5 minutes. I'm sorry, madam.
Yeah, it's very important. Try to be on time. Okay, is there any
Madam.
another question?
Yeah,
Okay.
I've got a question. On your slide, this slide 18.
Slide 18.
Yeah, on your slide that you
I've
upload.
already removed the slide, my dear. So you should ask them
Okay.
before I remove the slide.
I've got a contradiction about the
Because when we read about what?
Infants.
Yeah,
I need to understand.
Yeah, next time, please ask the question immediately. Yeah, when I'm discussing, yeah, when I'm reaching certain, I'm moving from one ask you the question. Because now this, yeah, please next time ask the question immediately. So slides 18.
18.
Okay.
Now,
Here it is.
yeah, in the first here, nutrition requirements increased at the stage. As the infant age increases. An infant 0 to 6 months needed 4,000 IUs of vitamin
International
A.
units. This is units for vitamin A.
Okay.
This. So what is your questions there? What is the question?
My question is, I've got a contradiction because I've already studied about the vitamin A deficiency. And the recommended daily allowance for 0 to 6 months is written about 1,100 and 300.
1,300. What is the unit?
International units.
Are you sure about that?
Yeah, I can share the slide of this 201.
Okay.
The lecture 3. There is a table showing that the international units for 0 to 6 months is 100,000 and 1,300. And not
300 international units for 0 to 6 month infant. Okay, I'm going to think about that.
But for the retinal activity equivalent, it is 400.
Now we are confusing. 400 what? I'm asking you about unit, you're just confusing us. You say that 400 international units is not right. For 0 to 6 month infant. That's what you.
Can I share you with that table?
No. Wait a minute. You say that. What I've been reading on my slides is not true, it's wrong. So you say that from 0 to 6 months, the child needs recommended intake is 1,300.
I don't say that it is wrong. I don't say that it is wrong, but I need to understand.
No, I'm just saying, I'm going to check it. Okay. I'm going to check from different sources and I'll come back. I'll answer your question in our next Zoom meeting. Okay? Is that okay to you?
Yeah, it's
okay. Understood. I will check on this, and I'll come back to you on our next Zoom session. Okay, thank you very much. The time is up. Meet you on our next Zoom session. Bye-bye. And
thank you, madam, for good discussion.
Thank you, madam.